So I'm going to be inserting a Foley catheter today. The first thing I'm going to do is verify that I have a provider's order to insert the Foley catheter. So the reasons this could be is for urinary retention or if my patient is going into a long surgery. So I'm going to come, knock on the door, introduce myself. Hi, my name is Kayla. Can I see your armband, please? Okay, and can you confirm your name and date of birth? And do you have any allergies? So they confirm their name, their date of birth. They don't have any allergies, but I would still ask them, are you allergic to iodine, latex, or shellfish? They said no to all three. So I'm going to be inserting a Foley catheter today. What that is a flexible tube that's going to go into, like a flexible, little tube that's going to go into your bladder. And then it'll just help with the flow of urine while you're in your surgery today. Are you able to assist me at all? Are you able to hold up your legs? So they told me that they are. So the first thing that I'm going to do is I would put my gloves on and I would raise the head of the bed, or raise the bed up, and I'll perform pericare. So after that, I would lower the bed, take my gloves off, perform hand hygiene, and get ready for my Foley sterile insertion. So I'm gonna come and I'm gonna open up the bag and make sure that my table is clean, dry, and waist high. So I'm gonna clean that off. Okay, go this way. And I'm gonna take the form out. And then take my sterile fluid. So this would just be used for trash during the procedure. So I'm just gonna put this down there at the foot of the bed. So I'm gonna go away from me first, making sure not to touch the inside. Okay, I'm going to take my gloves out. I'm going to try not to touch anything. So I'm going to open up my gloves. Making sure I'm not touching the inside. Put that down. Insert. It's sterile. On the other side. So the next thing I'm going to do is my drape. So I'm going to be careful not to touch my skin. Fold that around this way. And then my patient will be in the dorsal recumbent position with their feet about 2 feet apart. I'm just going to insert that underneath. Make sure to stay sterile. And then I'm going to get my station ready. So I'm going to touch the inside 1 inch, making sure not to go to the 1 inch border. Turn that. And I'm just going to pop this over. And now I'm going to get ready. So I don't need this, so I'm going to drop it. Alcohol ready. So I'm going to take these out. And then I'm just going to attach this to the port. So this is my 10 ml syringe. Okay. And then I'm going to get my lubricating jelly ready. All right. And now I'm ready to go. So I'm going to make sure to stay sterile. I'm going to come and create a runway. So I'm going to take my hand on the labia and pull up. I'm just going to tell her that you're going to feel my hand. So I'm going on center, come, trash bag, and then side, making sure not to cross my sterile field. and keeping my hands on the labia, not touching the sand there. And then I'm gonna move this up, lubricate it 1 to 2 inches. So I'm just gonna, so can you just take a couple deep breaths for me? I'm just gonna insert, making sure that my hand is not touching the perineum. And once I see a flashing urine, I'm just gonna continue another 2 to 3 inches. Okay, and I'm just gonna keep that stable. And I am going to insert the balloon with my 10 ml syringe. Okay, pull this up, disconnect, drop it. So I'm just gonna give it a slight tug, gentle tug, and it is secure. So next I am going to make sure that my bag is not kinked, and I am going to hang that up. Okay, so it will be hung up. And then I am going to remove my gloves and throw them in the trash, which would be right next to me. And I would secure the Foley to the patient's thigh, and making sure that it has some slag so it's not too tight. So next I am going to get on clean gloves, and I would clean up. And throw that in the trash. So I would document if the bag was filling up more than 800 to 1,000 mLs of urine, I would clamp the bag about 6 inches away from the port of the catheter, and come back within 5 minutes to unclamp that to prevent bladder spasm. So I would assist my patient into a comfortable position, clean up if they needed more pericare, and then make sure that they're okay, and I would leave, and I would document the color of the urine, the clarity, and the amount. I would document that I performed pericare and how well they tolerated the procedure, and that would be the insertion. So I would also document as well with the CCA, the color, clarity, and the amount of urine. I would document that I inserted a 14 French Foley catheter with a 10 ml balloon.